J-Roll Electronic Productions, baby.
Short span. So he must be sick or something. People who recover from COVID-19 at very low risk of reinfection, and very interested in this. Let's see what's going on with this, because because you got that antibodies. People who recover from COVID-19 at very low risk of reinfection, the study shows. I'm gonna save this because I can see myself referring back to this, and that way I can look at the study for myself. I always push looking at research and reading studies for yourself. I have a background in advanced statistics, so I am qualified in reading these studies and being able to understand it. I can actually read a study and do my own study on the study type stuff. Like, I've done that before. I have a few published articles, peer-reviewed articles. But let's see. People who have contracted COVID-19 and recovered should know that the risk for reinfection is very low, a doctor said after a study he worked on was published. Researchers analyzed records from Curative, a clinical laboratory based in San Dimas that specializes in COVID-19 testing and has, during the pandemic, been conducting routine workforce screenings. None of the 254 employees who had COVID-19 and recovered became reinfected, while 4 of the 739 who were fully jabbed contracted the disease. Very, very interesting. Very, very interesting. So the ones that got it regularly, got COVID, they didn't get it again, but the ones that actually received the jab, although it was only 4, they contracted the disease. Quote, the big takeaway was that if you are not jabbed and were not previously infected, you can have a very high risk of getting infected. 24% of employees over a year tested positive. However, on the flip side, if you were jabbed and previously infected, your risk was near zero. Dr. Jeffrey Clausen, clinical professor of preventive medicine and medicine at the University of Southern California's Keck School of Medicine, told the Epoch Times. That is great news because I had COVID. I don't plan on taking the jab because I had it. I'm gonna trust in my antibodies. I'm gonna trust in my body protecting me from it in the future. So, Clausen and Dr. Noah Kojima of the University of California, Los Angeles Department of Medicine joined with curative workers to analyze the records. They released a preprint or pre-peer reviewed version of the study online this week. So that just means it hasn't been peer reviewed yet. I'll check out the pre one, and then I'll be a peer actually that'll review it for myself. But researchers found that 4,312 employees who were not previously infected or fully jabbed, 254 became infected. The findings add to the growing body of research that indicates people who have COVID-19 and recovered enjoy a similar level of protection as those who have gotten the jab, following a study in the United Kingdom and one by the Cleveland Clinic researchers. So this is a really big study. United Kingdom, Cleveland Clinic, a bunch of people been studying this, and it seemed to all be saying the same thing, that if you had COVID, you don't really need to get jabbed because you're actually more protected than the people that got the jab. Let's say, quote, it should give confidence to people who have recovered that they are very low risk for repeat infection, and some experts, including myself, believe that protection is equal to vaccination. I think from the numbers, it's not equal. It's actually better than getting the jab, it looks like. And we're trying to update policies such that people who have recovered have the same privileges and access as people who were jabbed, which should be the case. According to federal guidance, vaccines, jabs should be administered to people irrespective of whether they had COVID in the past. The Centers for Disease Control has said officials are aware of the evidence suggesting natural immunity among those who have been infected, but has not altered its recommendations to incorporate the evidence. They should. Why? Because they want everyone to be jabbed. For why? I don't know. I don't know why you have to get the jab if all of the evidence, all of the data, all of the science is showing that if you actually had it, you actually better protected from natural immunity than you are if you actually had the jab. This is science. And they're not. They need to update. They need to update their recommendations. Quote: "We do not comment on CDC authored papers. We continually evaluate the science that leads to our guidance, and if it needs to be changed, we will be based." I guess that was a mistake there. "We will base that on our own research and studies," a spokesman told the Epoch Times in an email last month. The limitations of the new study, which has been submitted to a journal and is being peer reviewed, included the possibility employees could have tested positive for COVID-19 outside the routine screening or employees testing program. The group plans to conduct more analysis on the curative data. Dr. David Boulware, professor of medicine at the University of Minnesota, told the Epoch Times via email that the study, quote, "adds to the body of literature that generally healthy adults under 65 years old with prior COVID infection are generally not at risk of recurrent SARS-CoV-2 infection in short term after initial symptomatic infection. SARS-CoV-2 is another name for CCP, Chinese Communist virus, which causes COVID-19. Boulware, who was not involved in the research, noted that the median age of those tested were 29 years old and very likely included few people 65 years or older or many people without immune system problems. Quote, "Thus, this may not apply to elderly persons or persons with substantial comorbidities." We know this already, but does likely apply to adults 18 to 65 of age without major medical problems, he said. Adding that because the follow-up time period of those studies was relatively short, the paper does not give insight into longer-term protection. Long-term protection is more unknown, which is why persons with prior infections still are recommended to receive. But what about the jab, though? You know what I'm saying? Recommend to receive at least one jab dose. But there is not any urgency to receive the jab, and waiting 3 months likely would be fine, he said. They still pushing the jab on people. Klausner said that besides bolstering the idea of natural immunity, the study shows that jabs in the workplace is important. Quote, "We need to continue to promote workplace jabs requirements. Businesses have the authority to have the ability to have the legal power and have the legal power to require employees to get jabbed," he said. And I think this did the support that benefits that. Whatever, man. They're still pushing the jab, even though natural immunity seems to be outperforming getting the jab. It looks like I need to look at the study for myself, but off of this initial article here, that's what it looks like to me. Let's
J-Roll Electronic Productions, baby.